We're having to do this virtual WebEx training because of the COVID. These are really troubling times for the city of Laredo, and we no longer are able to meet face-to-face with City of Laredo employees, like every year we used to do at the public library. We are testing this for the first time, this virtual training, so be patient with us. If there's any technical difficulties, we'll try to make it better next time. Don't worry about the presentation. This presentation will be emailed to City of Laredo employees or recipients. It will be posted to the HR website, and also we will post it to the HR public folders, and we'll try to post it also on YouTube. Okay, at this time, Laurel Insurance and Associates, Tina Cerda and Blas Martinez will help us provide this presentation for you. Good morning, Tina.
Good morning, everybody. Thank you all so much for being with us. As Alma said, these are indeed unusual times, but we're excited about the opportunity to embrace these new ways of communicating with everybody. If you have questions, please don't hesitate to put them in the chat. And at the end of the session, I will go through all of the questions and try to answer them. So what we're going to talk about today are, under the medical plan, your new options for 2020, some changes to the contributions, the city wellness plan, different resources that are available to employees, recap the dental plan, and then some of the additional benefits that you have under life and disability, cancer, critical illness, accident and vision insurance. Next slide, please. Let's talk about your choices in 2020 under the medical plan. The city's continuing to use Blue Cross Blue Shield as its third-party administrator for the medical plan. Keep in mind that every penny that is spent on medical expenses is actually coming from the city of Laredo. They reimburse Blue Cross for the claims on a weekly basis. So while Blue Cross Blue Shield is the administrator, the funds that are used are actually the city of Laredo's funds. We're going to continue to have the two plans that you had previously. The traditional PPO Plus is going to be the new name for the traditional plan, and the consumer-driven plan, which is a plan over on the right-hand side in the green. However, we're introducing two new plans, the traditional PPO Core plan, which is in orange, and the HMO Blue Essentials, which is in blue. I'm going to go over each plan in detail, but I do want to point out just a couple of highlights so that you have these at the forefront of your thought process. The deductible on the traditional on the PPO options will continue to be $1,000. The HMO deductible is going to be $1,200, and the consumer-driven deductible is $2,800, $2,800 per individual, and then it's usually double that for your family. Your out-of-pocket maximum, which I like to tell people is the most important figure to look at. This is the amount of money that you would spend in a calendar year before the city of Laredo pays all of your expenses at 100%. Your out-of-pocket maximum under the traditional plan is $7,150. Under the traditional PPO plan, which is the new one, Core, and the HMO Essentials, which is also new, that out-of-pocket maximum is $8,150. Once you've paid that, the city will pay the remainder of your expenses for the calendar year at 100%. The consumer-driven health plan has the lowest out-of-pocket maximum at $2,800. So once you've paid out your deductible, from that point forward, the city pays all of your expenses at 100%. Now, the first three plans, the traditional PPO Plus, the traditional PPO Core, and the HMO Blue Essentials, all incorporate copays for your medical providers. You're going to pay $25 when you see a primary care specialist, physician, $40 when you see a specialist, $40 at the urgent care center, and under the PPO plan options, you have the opportunity to use the MD Live, which is the virtual physician, for $25. Under the consumer-driven health plan, all of your expenses are subject to the deductible, and once you've met that deductible, they're covered at 100%. Another big change that you're going to see this year is on the emergency room. The copay on the emergency room is going to be $300. Once you've met that $300 copay, you're going to pay an additional 20% of the emergency room services under all three provider-based plans. And then, of course, under the consumer-driven plan, you'll pay 100% of the emergency room costs up to that $2,800 out-of-pocket maximum. Preventive screenings are covered at 100% in-network on all four options. We'll talk about out-of-network services shortly. Your prescription drugs are also going to be very similar on all four plans. Generic drugs covered at $15, preferred brand name drugs covered at a $40 copay, non-preferred brand drugs at a $60 copay, and your specialty drugs will now have a $150 copay. So that is a new tier that's been added. Of course, your biweekly deductions are going to be different depending on which plan you choose. The consumer-driven health plan will be the most cost-effective plan for you. And then as you increase those benefits, you'll see that your contribution for your benefit plan will increase as well. Next slide, please, Alma. Alma, next slide. So let's talk about your network. Blue Cross Blue Shield uses networks of physicians to maximize the expenses or the costs that the employees accrue towards their medical plan. A PPO plan stands for Preferred Provider Organization. These doctors have all agreed to provide services to Blue Cross Blue Shield members at a discounted rate. And as a part of the Blue Cross Blue Shield family, you get to participate in those discounts because your coinsurance, or the percentage that you pay, is based on those discounts. So under the PPO plan, your biweekly deductions will be higher. Your annual deductible will be lower. Your copay features are included. Your coinsurance, this is the percentage that you pay, is 20%. The city pays 80%. You do not need a primary care physician under the PPO plan, and no referral is required for out-of-network, for specialty visits. There is nationwide network, so you can go anywhere in the country. You do have a high annual out-of-pocket maximum. You can participate in the flexible spending account program with the PPO. There is out-of-network coverage. So that's important to be aware of. On the HMO, your biweekly deductions are going to be a little bit lower. You still enjoy a low annual deductible. You still have the copay features. Your coinsurance, which is the percentage you pay, is going up to 30%, and the city pays 70% after your deductible. Important consideration, you must select a primary care physician at the time of enrollment. A primary care physician is considered a family practitioner, general practitioner, pediatrician for children, sometimes obstetrician gynecologist for women, and internal medicine specialist. What I want to point out here is that some OBGYNs and some internal medicine specialists do not provide primary care services. So while they may be internists or OBGYNs, they elect not to be considered primary care physicians. You must have a referral from your primary care physician to seek the services of a specialist. So your primary care physician will complete the necessary paperwork and submit the necessary documentation to justify your referral to a specialist. There is no coverage outside of the network. This is a Texas-based network only, so it's not a nationwide network. Your annual out-of-pocket is still high. You can also participate in the FSA, the flexible spending account. And again, this is a Texas-only network with no out-of-network coverage. And that's the big thing to be aware of, is that you cannot, if you see providers that are outside of the network, it will be entirely at your expense. Under the CDHP, we also use the PPO network, but your biweekly deductions are lower. Your annual deductible is higher, but your out-of-pocket is significantly lower. The city pays 100% of your expenses after you've met that deductible. There are no copay features and there are no referrals necessary to see a specialist. Same nationwide network as the PPO option, lower annual out-of-pocket, but now we incorporate a health savings account, which works differently from the flexible savings account. We'll talk about that in a moment. You've got that nationwide network, and you do have out-of-network coverage. Next slide, please. Under the consumer-driven health plan, which is the most cost-effective option that the city provides its employees, you'll see that your deductible in 2021 on the column on the right goes from $2,700 to $2,800 a year, $2,800 a year per individual, and $5,600 a year per family member. Your out-of-pocket maximum is also increasing to $2,800 per individual and $5,600 per family. This is in compliance with the IRS regulations that govern the way consumer-driven health plans are administered. So it's not the city that's raising the deductible; it's really the Internal Revenue Service and their criteria that they set forth. All of your deductibles and copays apply to that out-of-pocket maximum. Your physician services, your specialty services, your urgent care visits, your emergency room, your hospitalization, all of these expenses are covered at 100% after you've met the deductible. After you've paid out $2,800, from that point forward, the plan will cover at 100%. The retail pharmacy medications are generally covered after the deductible. However, certain preventive ACA preventive drugs, again, a list that's put together by the federal government, will have a copay of $15 for generic, $40 for name brand, and $60 for non-formulary. Previously, the city was covering certain preventive drugs at 100% with no cost sharing on the part of the employee. Those people will now see that they're going to have a copay feature incorporated into their plan. Their drugs will no longer be covered at 100%. Next slide, please. I mentioned earlier that we do incorporate something called a health savings account. The city contracts with HSA Bank to administer this health savings account, which is an account that you fund with monies that are deducted from your paycheck pre-tax. They go into this health savings account, and you can use this account to pay for unreimbursed medical expenses. Not just things that are on your medical plan, but also eyeglasses, dental services, prescriptions, etc. The bank that administers it is called HSA Bank. That's all they do. They're not a brick and mortar bank. They exclusively provide HSA services. The money is yours, and it remains yours for the remainder of your life. You can continue to contribute to this account once you've, as long as you're on a high deductible option, and you can use these monies to pay for unreimbursed medical expenses without paying taxes on those monies. So it's a really great benefit to have. Again, this money is yours. Whatever is left at the end of the year rolls over, so you can accrue a nice nest egg towards your out-of-pocket expenses by utilizing the services of the HSA account. This account is available only in conjunction with a CDHP. You must have a CDHP option in order to enroll in the health savings account. Next slide, please. The HMO benefit, which is new for 2020, is $10 a month for the employee. So this is the next step up from the CDHP. You do have an annual deductible of $1,200. The co-insurance, this is the portion that you pay after you've met your deductible, is 30%, and your out-of-pocket maximum is $8,150. Once you've paid out $8,150, the rest of your expenses are covered at 100%. Physician services, preventive screenings, as I mentioned previously, are covered at 100%. One of the questions we got previously is what is considered preventive, and these are going to be services that are based on your age and gender. So, for example, mammograms are generally considered a preventive service for women over the age of 35, but a woman under the age of 35 or a male that receives a mammogram would not have the mammogram covered at 100%. So they're very specific to your age and gender. Your primary care physician copay is going to be $25. Your specialist copay is going to be $40. A referral is required to see that specialist. Your urgent care visits are going to be $40, and virtual visits via MD Live are not included in this option. Your emergency room is covered with a $300 copay plus the 30% coinsurance, and your prescription drugs are going to be $15 for generic, $40 for preferred brand name, $60 for non-preferred, and $150 for specialty drugs. Now, I want to go over what types of drugs fit into these categories. Generic drugs are those medications that are manufactured by multiple manufacturers. So as a consequence, they're called generic. These are the ones whose names we can never pronounce. Preferred brand name is a brand name medication that's still under patent, but the manufacturer has agreed to a discounted amount with Blue Cross Blue Shield, and consequently, they're included on the preferred brand name list, and you get this lower copay of $40. Non-preferred brand names are also brand name medications, but they have not agreed to a discount, so you're going to pay that higher cost, $60. Specialty drugs are those medications that are developed and prescribed for very specific and unique conditions like rheumatoid arthritis, for example. Those folks that are on a specialty drug, they're going to see their copay go up to $150. Now, if you're on a specialty drug, in all likelihood, you already know it because you have to fill the prescription at a special pharmacy called a specialty pharmacy, and there's some specific hoops that you need to jump through. On the HMO plan, there is no out-of-network coverage. So if you go out-of-network for any reason, you will see that you are not going to have any coverage for going out-of-network. The biweekly cost on this is just a little bit higher. It's $10 for the employee only, $135.65 additional for the spouse, $90.43 for children, child or children, and your family is an additional $267.28. Each person that is enrolled in this plan must choose a primary care physician at the time of enrollment, and you can make changes to the primary care physician each month. So if you enroll your entire family, everybody needs to have a primary care physician selected at the time of enrollment. Next slide, Alma. So some frequently asked questions about the HMO network. Do I need a primary care physician? Yes, that's what we just spoke about. Under the PPO, you do not need to select a primary care physician, but you should have one. It's very important to have a doctor that you can turn to, especially right now in these difficult times. Folks that don't have a doctor are really struggling more to access medical care. Do you need a referral to see a specialist? Yes, you do need a referral to see a specialist. You will need to schedule an appointment with your PCP or a telephone call with your PCP, and then he or she will provide a referral for an in-network specialist. Under the PPO option, you do not need a referral to see a specialist. This is a really important question. If you're currently seeing a doctor, specialist, or attending a facility that is out of network, can you continue to receive care from them and be covered? No. The only exception to that would be in the case of a true medical emergency, which is considered a life or limb-threatening condition. Otherwise, any out-of-network physicians, facilities, et cetera, you would have to pay the entire cost on that. Under the PPO option, you can continue to go out of network, and you would pay, the plan would pay a lower percentage, but you would get some reimbursement for that. Cost comparison, the HMO is going to be a lower cost plan compared to the PPO. Next slide. So on our first PPO option, which is the traditional PPO core, this is a new plan that's being offered for 2020. We've got an annual deductible of $1,000. Your co-insurance after you've met the deductible is 20%. So that means you pay 20%, the city pays 80%. Your out-of-pocket maximum is $8,150. Once you've paid $8,150, the plan will cover the remainder of your expenses at 100%. Again, your preventive screenings are covered at 100% based on age and gender. Primary care physician copays are $25. Specialist copays are $40. Urgent care copays are $40. And this plan does incorporate the features of MD Live, which is a virtual physician, which many of you have had the opportunity to take advantage of. That's a $25 copay. Your emergency room has a $300 copay, plus you'll pay 20% of the expenses. Prescription drugs will be identical to the HMO, $15 for generic, $40 for brand name, $60 for non-preferred brand, and $150 for specialty drugs. If you go out of network, your deductible will be double, $2,000. The city will pay 60% and you'll pay 40% of your expenses, and your out-of-pocket maximum jumps to $16,300. Now, I do want to point out that when you go out of network, the 60% that the city pays is going to be 60% of what's called the allowable amount. So the difference between what the provider charges and the allowable amount can be your responsibility. Physician services will be covered at 40% after the deductible, so no copays for out-of-network physicians. That's not a feature. The MD Live is not available for out-of-network physicians. Emergency room copay will continue to be $300 plus 40%. This is when you go to an out-of-network emergency room. Prescription services would be covered at 40% after the deductible. I recommend that if you need to see an out-of-network provider for any reason, that you make it a point to fill your prescriptions in-network so that you can realize the advantage of these very affordable copays. Your biweekly deductions on this plan are going to be $20 for employee only. You'll pay an additional $142.51 for your spouse, $95 additional for child or children, and an additional $280.79 for the full family. Next slide, please. The traditional PPO plan, which is the one that you currently have, has a $1,000 deductible. Plan pays 20%, so here we're identical to the core plan. The out-of-pocket maximum is a little bit lower at $7,150. Your primary care physician will still be $25. Your specialist is $40. Your urgent care facility is a $40 copay. The MD Live feature is included, and that's a $25 copay. The emergency room has a $300 copay plus a 20%. Your preventive screenings are covered at 100%, and your prescription drugs are also covered 15, 40, 60, and 150. And again, the big difference here is this out-of-pocket maximum. Now, if you go out of network, your deductible is $2,000, and your out-of-pocket maximum is $11,150. Other than that, it is identical to the core plan. So the big difference here is your out-of-pocket maximums. Your biweekly deductions are going to be $30 a pay period for the employee only, $149.36 for the spouse, $99.57 for the children, and $294.29 for the full family. Next slide, please. So looking at this comparison once again, you can see that the difference between the four plans, the big difference besides cost is going to be in the out-of-pocket maximum. Under the traditional PPO Plus plan, your out-of-pocket maximum is $7,150. Under the PPO Core plan, the new plan, that's $8,150. Under the HMO plan, it's $8,150, and under the consumer-driven health plan, it's $2,800. Copay features are included in the primary, in the traditional PPO Plus and the traditional PPO Core and the HMO Essentials plan. They all include copay features for your primary care visits, your specialists, your urgent care, and virtual visits are included in your 2 PPO options. Prescription drugs are $15, $40, $60, and $150 on the 3 plans that incorporate copays. And under the consumer-driven plan, only certain government-approved medications include that $15, $40, or $60 copay. So I would encourage you to take advantage of this opportunity to kind of think about how you use your health plan, determine if you go out of network a lot. If you do go out of network a lot, you may find that you need one of these PPO options. If not, the HMO feature may be perfect for you. The consumer-driven health plan allows you to incorporate that health savings account. If you're comfortable using the health savings account and are aware that when you go seek the services of a physician, you will have to pay the full cost of the visit, which is a discounted cost because Blue Cross has discounts with them, your out-of-pocket expenses are dramatically lower under the consumer-driven health plan. Next slide, please. So who can join your health plan? This is really important. So the City of Laredo opens its plan to all full-time employees and their eligible dependents. Your spouse, when you enroll your spouse, you must provide your marriage license or a common law certificate, a valid Social Security card, and verify that your spouse does not have access to medical coverage through their employer. Dependent children are eligible up until the age of 26. Once they turn 26, they'll have to go on their own plan. You must provide the birth certificate, Social Security card, child support order, if that's applicable, court orders, adoptions, or guardianship orders if you're enrolling either adopted children or grandchildren, et cetera, and marriage license if you're adding the stepchildren. Please be aware that the city does conduct dependent verification audits, so it's really important that when you enroll the kids or your spouse or children that you acknowledge that you're not providing any false information, and if you do provide false information, you understand that you may be subject to disciplinary action on that. Next slide, please. The city Human Resources and the Employee Health and Wellness Services provide a broad range of services that are open to the employees. Some of these services obviously are currently limited to the COVID-19 restrictions, but we still want you to know what they are so that you can try to take advantage of them when they come up. So you've got the Buena Vida blood work that's available once a year. The vaccines, free flu, tetanus, hepatitis B vaccines are available to employees at no cost. The flu shot, we're hearing a lot of talk right now about how important it is that we all get the flu shot this year. So please take advantage of the flu clinics when they become available. The InBody test, which is that machine that they've got stationed throughout the city that determines your body composition and weight distribution. It'll let you know not only your weight, but how much of your weight is related to water, bone, muscle, and fat. Physician services that are available, but right now they're restricted due to the COVID-19, or they're not available due to the COVID-19 restrictions. Nurse consultations, including a 24-hour nurse line that's available through Blue Cross Blue Shield, nutrition consultations, blood pressure screenings, physical activity classes, and disease self-management classes. So they really do a great job of reaching out to you and providing these additional services. Next slide, please. Blue Cross Blue Shield has a great app that you can download onto your smartphone. If you text BCBSTX APP to the number 33633, it'll send you the link over so that you can automatically download that app. Once you have that app and you register yourself, it'll give you all of the information about your specific plan, help you find in-network providers, let you know how much you've met of your deductible, give you an idea of how much your claims, how much has been paid, how much you owe, access a temporary member ID card. It's really a great tool. So we very much encourage you to take advantage and enroll with, put the app on your phone, because especially right now, I got a call over the weekend, somebody that needed an ID card. If you have your app, you've always got your ID card, because somehow we never lose our phones, but we do lose our ID cards. Next slide, please. If you log on to the Blue Cross Blue Shield site, bcbstx.com on the internet, among the things that you can take advantage of is this health risk assessment, and it's one of the points that you can earn towards your wellness points that the city provides rewards for. This health risk assessment can be a stop-start. You can do a little bit one day and come back and do a little bit more, but it gives you some really good insight into your own personal health condition, and we recommend that people consider printing that out, taking it with them to the doctor, so that when you have a conversation with the doctor, you can really have a meaningful conversation about the issues that genuinely impact you. Next slide. The city continues to provide a comprehensive dental plan administered by Aetna, also a self-insured plan, so the city is actually paying these claims. The high plan has a $50 individual deductible, and the low plan has a $25 individual deductible. Your preventive services, which are going to include your things like oral exams, cleanings, and x-rays, are covered at 100% under both options. Your basic services, which are things like your root canals, fillings, gingivectomy, and stainless steel crowns, are covered at 80% after the deductible. Your major services, which are going to be inlays, onlays, permanent crowns, and dentures, are covered at 50% after the deductible. Your orthodontics for children and adults are covered at 50% after the deductible, up to a $2,000 lifetime maximum under the high plan only. The low plan does not cover orthodontics. The annual maximum under the high plan is $5,000, and under the low plan it's $2,000. So that's the most that the plan will pay out per calendar year, $5,000 and $2,000. Your cost for the high plan is $6.83 for the employee only, $33.96 for the employee and family, no cost on the low plan for the employee only, and $12.31 for the employee and dependent. Next slide. The city also provides comprehensive life and disability benefits for the employees. In addition to the city-provided life insurance, employees have the opportunity to add additional life insurance up to a maximum of $250,000. So if you're currently interested in adding additional life insurance, you can increase your life insurance up to $250,000. You can go up by $20,000 a year without providing evidence of insurability. Otherwise, you do have to provide proof of good health. So when you go through the enrollment, you'll see that there's a link over to an online enrollment, an online evidence of insurability. So you'll have to answer some medical questions. Your spouse can get up to $100,000 of life insurance, and it can increase by $5,000 up to that maximum of $50,000. You can also insure your children. The maximum amount of coverage is $10,000, and that's for birth to age 26. Children over 26 are not eligible to be on your life insurance policy. So when you go through the enrollment, please double check and make sure that you're not paying for life insurance for any kids that are over 26. Disability insurance is there to protect your paycheck if you're not able to work due to an accident or an illness that occurs off the job. Any kind of accident or any kind of illness for which you're not getting paid. You can use your sick days, but anything where you're got a loss of paycheck. We've got two options. Disability Plan 1 kicks in after you've been out of work for 7 calendar days, and Disability Plan 2 kicks in after you've been out of work for 14 calendar days. Both plans cover you for up to 3 years. They're divided into 2 duration periods. The short-term disability, you'll receive a weekly benefit check of 60% to $1,000 for the first 12 weeks. And on the long-term disability, you'll receive a monthly benefit check of 60% up to a maximum of $5,000. New applicants, if you currently don't have disability insurance and you're looking to add this year, you will have to provide evidence of insurability. And just like the life insurance, there will be a link over so that you can fill that out. Next slide, please. The city also provides some optional cancer, critical illness, and group accident insurance. So I'm going to go over those very quickly. The group cancer is through a company called Guardian, and they pay cash payments for certain procedures like your annual screening. They'll send you money for your annual screening and treatments related to cancer diagnosis. So this pays on top of whatever your medical plan covers. The payments are made directly to you. And you can use this payment at these resources at your discretion. So if you want to use them to help pay deductibles and coinsurance, by all means, you can do that. If you want to use them towards other out-of-pocket expenses that you might be incurring, you can do that as well. Critical illness pays a lump sum benefit of between $10,000 to $50,000. For yourself, your spouse, and your children. If you enroll your spouse and children as well, they will pay this lump sum upon diagnosis with certain illnesses such as cancer, stroke, and heart attack, and other what we call dread diseases. Pre-existing conditions do apply to this. So if you enroll and you currently have a pre-existing condition, then there will be a limitation on how much coverage is available. And lastly, the group accident plan pays direct medical expenses that result from an accident. An off-the-job accident, any kind of accident will qualify from cuts and lacerations to broken bones, et cetera. They will pay a lump sum depending on the body part that is injured. Next slide. The city also includes vision insurance for the employees. You've got a $10 copay for an eye exam, $25 copay for materials. So what this means is that you go to get your eye exam, you're going to pay $10 for your eye exam, and then $25 for your eyeglasses or contact lenses. Keep in mind that this $25 copay is going to cover certain frames and lenses only. If you get into more expensive frames or additional enhancements on lenses, you'll be given an allowance towards those lenses, but it will not cover the full cost. In other words, you're not going to get Gucci frames for $25. Exams are covered every calendar year, and lenses and frames are available for coverage every year as well. Next slide. So some frequently asked questions. What if I log in? What if I don't log in and don't enroll? What's going to happen to my medical plan? You will default to the traditional PPO core plan. So keep in mind that has a $20 copay or biweekly deduction per employee, and then additional for children, spouses, and families. So if you don't log in and you don't enroll, you don't do anything, you're gonna fall into that $20 biweekly copay plan or deduction plan. What is considered preventive care? I answered this earlier, but just again, preventive care is based on age and gender, but typically includes services such as mammograms, immunizations, and PSA testing. Again, it's going to be age and gender based, so no two people are going to be exactly identical. Does the spouse eligibility rule apply to dental and other benefits? No. Your spouse can still enroll in the dental and ancillary benefits. It only applies to the medical plan. This is an active enrollment, so it's really important that you log into the Benefits Hub to make your elections Plan Year 2021. The system will open on August 25th, and it'll be open through August the 7th, Alma, or 8th?
September the 8th.
September the 8th, I'm sorry. If you feel you need individual enrollment assistance, we will be available telephonically, and we can set appointments so that somebody can walk you through. We will not be able to physically do the enrollment for you because we can't log in on your behalf, but we will walk you through each step of the process and are always available to answer questions. And with that, I don't see any questions in the chat, but I just want to double check. Does anybody have any questions out there before we log off?
We have available for city employees a new email addresses for questions. If you don't want to ask here in the chat, you can do it privately on the new email address is hrinsbenefits@ci.laredo.tx.us. Any questions? Anybody?
Thanks, Alma. I guess we should add that to this questions page too, so that we make sure that it's there. Thank you all so much for your time. Thank you for starting your Monday with us. Again, we're available if you have any questions or concerns, and we look forward to visiting with you virtually. Have a great week, everybody.